Hi, this is Dr. Shakir. So, on this particular case, what are the best treatment choice that you can give to the patient? So, option number one, extraction. So, as and when you grow your practice, you don't always choose a treatment plan to fetch more money. Rather, you choose treatment plan that comes with less relapse. So, here the patient is 4 year old and the permanent incisions will come into its position in another 2 or 2.5 years. So it's always better to extract it so that there is no relapse. And as per McDonald's, post the eruption of primary canines, that is 5'3" and 6'3" in this particular case, post the eruption of primary canines, there won't be any space loss in the anterior region like how you see in the posteriors. So there is no fear of space loss as well. And ever since the patient's concern is of aesthetics, after the extraction, you can always give a Gropus appliance. But this option was rejected by the patient, I mean the parent, because they were not ready to remove the teeth. So we move on to the choice number two, that is the most methodical or the theoretical choice, that is pulpectomy followed by a strip crown. But this method has a psychological issue with the patient and a technical issue with us. So what is the psychological issue with the patient? Rather the parent. They wanted just a white color filling and the teeth is asymptomatic. So it will be difficult for you to convince them for a root canal. And on the technical side, there are high chances that even if you try to get an access from either labial side or the palatal side, there are high chances that that coronal fragment will break down and it will come down to your hand. So it will make the situation more worse. So you as well as the parent both are going to combinedly reject pulpectomy. Now the third option is freehand composite. But when you think about a composite, just look at the teeth. Do we really have any enamel or dentine to etch and bond? Absolutely no. So the composite is of no use here. So all the three treatment strategies have been discussed with the parent. The option number one, extraction, have been rejected by the parent. The option number two, pulpectomy and strip crown, have been rejected by both of you. And the third option, composite, have been rejected by you. So what can be done now? So before you send the patient back, you can give them a last choice, that is a cement which is quite stronger yet not so aesthetic, that is GIC. You say them the cost of your GIC as per what you charge in your clinic and tell them that we cannot give a guarantee on this unless you ask the child to maintain the particular cement by not biting any hard objects or cut short the consumption of sugary substances like chocolate. So unless you maintain it, it's not going to stay. Say them and give them the treatment charges for GIC, and they are going to accept that. That's what we did in this case. And there is a post-op picture. Of course, you all know how GIC would look like in an anterior teeth. The patient was happy, the parent was happy, but it's not something that we can flex in Instagram. So this is how you manage this case, and this is of no academic use. This is only something that you can apply on your clinical side. So your academic answer should be pulpectomy followed by strip crowns.